Good afternoon. We come to you today on a day that just feels good. A day of tremendous appreciation for so many folks in our community who come together to help us get through what was truly an unprecedented situation. And in this unprecedented situation, our community responded. We dealt with adversity, difficulty, hardship. And while COVID-19 remains, and while we will continue our efforts around testing and vaccination and monitoring cases and hospitalizations, today with the retiring of the blueprint signifies a massive step forward as a community in returning to what normal was pre-COVID-19. I've had the opportunity today to visit with members of the public, with county workers who helped aid in the response, and I can tell you that there is just a general sense of not just relief, but a sense of exuberance. A sense that we faced the greatest public health crisis our country has seen in more than 100 years, and we made it through. We made it through in days where it didn't feel like we could keep going on, but we did. And I want to express on behalf of the entire county government our deep appreciation for each and every San Diegan who sacrificed, who worked hard, who came together, who supported one another, who helped one another, neighbors looking after neighbors, grandkids making their grandparents' vaccine appointments. So many folks across our entire community who got us to the place we are today, which is moving beyond the blueprint, lifting essentially all restrictions, reopening all aspects of our life. And so today at our last regularly scheduled COVID briefing, I just want to convey my deepest appreciation and thanks for everyone for everything that we've gone through over the course of the last year. We know that COVID will remain a presence, but because of the vaccine, those that have been vaccinated have a degree of safety. We continue to urge and encourage all San Diegans, please make sure you get your second shot if you received your first shot. And if you have not yet gotten vaccinated, please trust your medical experts, your doctors. The vaccine is safe, it is effective, it is free. And as a county, we will continue to make it widely available throughout what we're doing. But as we begin to move forward, it gives us an opportunity to really reflect on so much of what's transpired. It was 501 days ago today, our Emergency Medical Operations Center was activated. And during that time, our county has done incredible things, more than 5 million tests. And when I say county, I mean our healthcare partners, our clinics, our county government, and everyone coming together to respond. More than 300,000 case investigations, almost 10,000 individuals supported with public health rooms, 75.5% of eligible San Diegans who received their first dose, more than 43 million items of personal protective equipment acquired and distributed to more than 2,500 facilities. We saw from the early days of the positive folks flown in, to the cruise ship, to the declaration of the state of emergency, to the initial actions we took, the convention center operation moving unsheltered folks in, the testing infrastructure, the first vaccine superstation, and we could go on and on and on with all of the work and effort we've done. But I think San Diego showed our resilience. We showed our willingness to endure tremendous hardship. We showed our compassion. We showed our empathy. We were transparent in sharing what we were doing and why and what we knew and what we didn't know and the data associated with it all. And I believe as a county, we ought to take a measure of pride in our response and how we managed and navigated our way through it. I want to take a special moment to just thank a couple groups of folks. And then for old time's sakes, we'll do one more run through the slides just because it wouldn't be a COVID briefing if we didn't have some slides. But I want to say a special thank you to our healthcare workers. At all of our area hospitals and clinics, our nurses, our doctors, the administrators, the clinical staff. We were so fortunate to have incredible partners. And that partnership between our healthcare system and our providers and that county government was essential to this. And I want to thank our healthcare workers who literally put their lives on the line. Some of them gave their life by treating and helping individuals who were sick from COVID and other things. And we are eternally grateful for the heroism that our public health workers showed. I also want to thank our essential workers, everyone from our grocery store workers and our cooks and those individuals who showed up to work every single day to keep our economy running and going. We are grateful to you. Again, many of them also gave their lives, lost their lives as a part of what we went through in COVID, and we appreciate their sacrifice. Our small business community that endured so much, open, close, inside out, but kept fighting, and we're now poised for a tremendous economic recovery, and to truly, I believe we will roar back and come back. I want to thank our nonprofit community who stepped up to fill the void, whether it was feeding seniors, taking care of kids, providing aid and assistance to the unsheltered, but our nonprofit community who never stopped fighting for the causes that they believed in. And in particular, I want to thank our county workers. Every day we can get up and say, well, we want to do 50,000 vaccines a day, but the statement of wanting to do that requires hundreds and thousands of individuals to fight through incredible challenges in a very dynamic and fast-moving environment. I had a chance today to personally thank our county workers involved in the response, but as chair of the board, we owe each and every county worker a tremendous debt of appreciation. And in particular, I want to thank the members of the Joint Information Communication Center who are here in this room with me here. When we speak, you see myself or Dr. Wooten or Supervisor Vargas, but in this room are an incredible group of individuals who make all of this work, and they have done it hundreds of times, providing information with last-minute changes and adaptions, and they have done it with grace and class, and it's been my honor to work alongside each and every one of them. In that same vein, I want to thank the members of the San Diego Press Corps. Your mission and job is to hold us accountable and to inform the public. And throughout COVID, we have done the very best we could to tell you everything we knew about what was happening and to take every question you had about what we were doing. And I believe the people of San Diego benefited from a press corps that was informed, that stayed with us, that digested the information, that pushed us, that called us out when we made mistakes, that held us accountable, but also provided a tremendous resource to the public in providing them quality information and content about what was happening and what was changing. And as a member of the San Diego Society, I'm appreciative for the role that the reporters played. And a special thank you to those who have tuned in and been a part of each and every single one of these briefings. Your follow-up questions, your this doesn't make sense with that, all of that has been a tremendous service, and I'm grateful. And then finally, in a point of personal privilege, I want to thank my wife. I'm not just a county supervisor, I'm a husband, I'm a father. My wife has an incredibly difficult job, and when this all happened and our three youngest who are still in public school had to do Zoom learning from home, my wife made it all work. She kept doing her job remotely. She took care of the kids, she maintained our household. As women often do, they run everything and get everything done right, and I'm incredibly appreciative to her and to all of those out there who kept everything going. So thank you to everyone. We don't have any additional briefings planned. We will continue again to provide the data surrounding cases and hospitalizations and testing and vaccinations. And should there be some reason that we need to reconvene to share some information, we will call it. But this will be our last regularly scheduled COVID press briefing. Our efforts, again, around COVID will continue. We continue to urge San Diegans to get vaccinated. Please do that, and we will continue to work to make them available along with monitoring the situation moving forward. But again, we're so grateful and appreciative for everyone. Today's a day we feel good, and it's okay to feel good. We have made it through a truly historically challenging situation, and I think that we're coming out stronger. With that, let's go to a couple of our slides, then we'll hear from Vice Chair Vargas and then get to your questions. First off, an incredible slide here. Again, you see almost 4 million doses administered. We set a goal of reaching 75% of our eligible population. Our first dose now is 100.6%, 83.9% of our second dose. We continue to be a tremendous leader in California and across the nation with this, and we are appreciative of all of our healthcare partners that helped us get to this point, along with all of the San Diegans who've been willing to trust our doctors, our public health officers, and our medical experts for everything they're doing. Next slide. Cases are pretty flat. Looks good, 0.8%, 61. Again, we will continue to report and share these as we move forward on our website and with what we send out. But total number of cases today at 281,000. State monitoring metrics. Last time to look at these, again, case numbers continue to be good, relatively flat, almost identically flat last week to this week. And again, the tiers don't matter anymore because there are no more tiers, which is a good thing. Our COVID-19 response, I mentioned a few of these, over 5 million tests, 300,000 case investigations, almost 10,000 individuals in safe lodging. You see the vaccines, the number of days, and more than 44 million items of personal protective equipment distributed to almost 2,500 facilities. Beyond the blueprint, as we take a peek at what that means, let's go back one to the masks. Thank you. For vaccinated individuals, not required in most settings. There's a couple settings where masks are required: public transit, K through 12 schools, healthcare, homeless shelters, emergency shelters, and cool zones. For the unvaccinated, it will be required in indoor settings. I think the issue with Cal OSHA will be resolved in the next 48 hours to align all mask guidance with this requirement. And then again, beyond the blueprint, we're just looking at, for almost all activities, no capacity limits, no physical distancing. In almost every setting, no masks for those who are vaccinated. The couple areas where masks are required, and some modest things around mega indoor events. But outside of that, we encourage everyone to safely resume life. And you know, my hope is, as we go back, there's a lot of things that perhaps we took for granted pre-COVID, and I hope we certainly appreciate a lot of those things as we move forward. With that, let me turn it over to Vice Chair Vargas.
Thank you, Chair Fletcher. Today really is a wonderful day for all of us. Our county reached a major milestone in our fight against COVID, and after 15 months, all of the work that the county did has really been an important part. I've been here since January, and it has truly been an honor to work with all of you as we're moving our county forward. I just really want to highlight that the impacts of COVID, as you know, resonated throughout our county, but there were particular communities in the South County that were impacted the hardest. And I am just so proud of the work that this county did to deliver countless resources and information to keep our individual families safe. I am proud of the work that we've done. I am really proud of the fact that we really thought outside the box. We created interventions. We really looked at our community partners, our school board members, our mayors, our cities, and they were our true partners in this process. Sometimes it wasn't as easy as we would have liked it to be, but we worked through it together, and I think if anything we take today from COVID is that together we can do anything. We've made a lot of progress, and we're going to continue to rebuild our communities in an equitable manner so our businesses and our families can thrive a lot. As a county, we're going to continue to be the safety net for our communities and provide the support that those that have been impacted the most. We know that although COVID ends today, there's still a lot of work for us to do in the next couple of months to make sure that our communities feel safe and we can fight for economic recovery. I do want to say thank you to Chair Fletcher for being a great partner in this journey. As I said, I started on January 4th, and I talked about hitting the ground running, and boy, did we hit the ground running. And so, you know, I'm really proud that when we talk about us as a county being an equity-minded county, it's not just a board policy that we did, but that we actually took it to heart and did the right thing from creating, opening up, super stations in Chula Vista to making sure we had, new ways of reaching out to our communities. And I'm hoping that we're going to take all those lessons learned as we continue to be the safety net for our communities as a whole. Esta tarde estoy muy agradecida con la oportunidad de estar con todos ustedes. Marcamos un logro muy importante en nuestra lucha contra el COVID-19 con la reapertura de nuestro edificio administrativo y la reapertura de nuestra economía. A partir de hoy, el uso de cubreboca no es obligatorio para personas que ya están vacunadas, pero si no ha recibido su vacuna, se recomienda que se cubra su boca por su protección. Las personas vacunadas no necesitan usar cubreboca excepto cuando andan en transporte público, escuelas o guarderías, hospitales, clínicas y albergues. En cuanto a los negocios, cada propietario tendrá la libertad de hacer sus propias recomendaciones y lineamientos para mantener a sus clientes y empleados seguros. Definitivamente ha sido un largo camino, pero nuestro equipo aquí en el condado y todo nuestro personal ha hecho todo lo posible para servir a nuestros residentes y realmente estoy muy agradecida por todo el trabajo. Los impactos del virus impactaron no solamente al condado en general, pero también a nuestras comunidades en el sur de San Diego. Quiero agradecer al apoyo de nuestros líderes comunitarios que en realidad hicieron todo lo posible por trabajar juntos para salir adelante y mantener a nuestras comunidades seguras y saludables. En la región del sur del condado estoy muy contenta que el 80% de los residentes ya tienen su primera vacuna, cuando hace unos meses era la región más impactada por la pandemia. Las comunidades que en un momento fueron las más impactadas son de las más exitosas en su recuperación. Nuestro fuerte enfoque en la equidad y el trabajo en las organizaciones de la comunidad dio resultado. Así que estoy muy orgullosa de que juntos hemos hecho mucho para salvar vidas. Así que por este tipo de intervenciones muy innovadoras, hoy estamos llegando a estos números y a pesar de que aún queda camino por recorrer, estamos más cerca de la recuperación. Y aún tenemos mucho trabajo por delante, debemos seguir trabajando para reconstruir de una manera equitativa, que nuestros negocios y familias prosperen. También quiero dar las gracias a todos los colaboradores de la comunidad que estuvieron al frente compartiendo recursos y dando servicios a nuestros residentes y a cada uno de ustedes de la comunidad que hizo su parte siguiendo las recomendaciones de salud para mantener a unos a los otros seguros. Así que hoy celebramos la reapertura de nuestra comunidad, hagamos conciencia y sigamos protegiendo dentro de los medios de las medidas posibles. Respetamos a los que deben seguir, los que quieren seguir usando su cubrebocas y trabajemos juntos para llegar a la recuperación y así seguir construyendo comunidades saludables. Y me da mucho gusto haber podido hablar con ustedes en español durante toda esta crisis pandémica, porque creo que es muy importante que todas nuestras comunidades tengan la información que se merecen. Gracias.
All right, we'll now go to our call-in questions.
Matt Hoffman with KPBS.
Hi, as it relates to masking, we know that obviously that there's some sectors which you guys outlined where everybody will still have to wear masks. Is the county going to be providing masks to like public transit or the airport, or should people just expect to carry a mask on them just in case they might need it?
I mean, look, I think folks have gotten used to having a mask. I mean, I think in the floorboard of my car, there's probably about 600 of them. But, as chair of a transit agency, I think we'll certainly continue to make them available. So I suspect in healthcare settings, hospitals, again, when I entered the VA to get a vaccine, they were giving you a mask if you wanted one. I expect that'll continue. I think in transit, we'll certainly continue to make them available. And if there's a shortage of someone without a mask, I think we will be able to accommodate them. So I think most folks will probably, grow accustomed to using them in those settings for a while. But if not, I have no doubt that there will be plenty available.
And then as we move past the sort of blueprint here, we move past the California June 15th reopening. This question more for Dr. Wooten, but also anybody else who wants to answer. How are you feeling? Are you any concerns or anything that you're looking forward to?
I'll have Dr. Wooten answer that.
Good afternoon, and thank you for that question. So the question is, how am I feeling? Well, I'm feeling very grateful, very hopeful, and optimistic. As has been stated, we have vaccinated a lot of people in San Diego, and that is what is helping us to decrease the COVID-19 infections in San Diego. So, and also people getting vaccinated have a decreased risk. So we are very excited about where we are today. But it doesn't mean that things are over. As I continuously state, the eligible population right now for being vaccinated is 12 years of age and older. But we, in the coming months, in this year, we have to focus on vaccination of those individuals 6 months of age to 11 years of age. The vaccines aren't available yet, but they are coming. So we have to be ready when that occurs. In the meantime, we will continue to do what we do, which is surveillance within the general community for COVID-19, and as well as over 80 other communicable diseases that we still monitor during this pandemic. So we will continue to do what we do and keep the public informed when there's something new to report. Thank you.
Our next call is Paul Sisson with the San Diego Union Tribune.
Thanks so much for taking our calls today. I wonder if Dr. Wooten might talk a little bit about what is a warning sign that that would cause concern that we're headed back for some kind of increase in cases. Is it being over a certain number of cases per day? Is there any certain rule of thumb that she's following in this case?
Thank you for that question, Paul. Well, obviously, the most thing that we would be concerned if we would see cases starting to increase. And probably for the last month, and particularly in the past 14 days, most of our daily cases reported have been less than 100. We really want to see that go down to less than 50. Work and research that's been done by Johns Hopkins shows that when you start seeing 0.05 cases per 100,000 population, which for San Diego would be, or 0.5 per 100,000 population. For San Diego, that would be 17 cases a day. When you start seeing cases, daily cases in that range, that would mean that you are coming, basically, it would be cases that you could manage on a reasonable level. So we aren't anywhere close to that, but we will continue to monitor our daily cases, hospitalizations, deaths, as well as outbreaks. And you may not have noticed, but in the past 7 days, we've reported 3 outbreaks. And as you know, our threshold is 7, so we don't want to see more than 7 outbreaks in a 7-day period. So we have a lot to be grateful for and thankful for, and it's thanks to the community, our various healthcare sectors, and the media has helped to get the word out as well. So we thank you all. Thanks.
Dr. Wooten, one final question. We've had reporters out in different locations today as the mask mandate has changed. Many appear to be keeping their masks on. Many don't seem to quite realize that anything has changed. I wonder, you personally, I saw you were wearing a mask when you came up to the podium. Would you continue wearing masks when you went out to, say, the grocery store or a gym or what have you, a restaurant? Are you going to keep wearing your mask?
Probably so, because the grocery stores require you to wear a mask. So we will continue to follow the rules of the various businesses that are posting the guidance. But in general, people that are unvaccinated, particularly outdoors and then even indoors, do not need to wear a mask. It's not required, but you don't know who's vaccinated or who not. So that's, or who is not. So that's the risk that everybody is confronted with. The guidance is out there from CDC, and we will follow those guidance. The CDPH, California Department of Public Health, is following those guidance as well. But there are definitely 9 settings that whether you are vaccinated or not vaccinated, that you still have to wear a mask. And we will certainly promote that guidance and adhere to that. And as you may already know, even in our government, right now we are wearing masks because we are waiting for the worksite final word guidance from Cal OSHA. So until we get that, we will continue to wear masks in our county facilities. Does that answer
Doctor,
your...
a point of clarification in terms of grocery stores. I thought that the new rules allow individual grocery stores to allow people who are vaccinated to shop without masks. Is that not right?
But the people... Paul, if businesses want to continue to require people to wear masks, they can do that. What the CDC and CDPH, if you are vaccinated, you are not required to wear masks. If you are vaccinated, you are not required to wear a mask. If you are not vaccinated, you should wear a mask. You should wear a mask. The issue with that is that you don't know, people could not be vaccinated and they would not be wearing a mask, and you don't know that. So if businesses want to require their patrons to continue to wear a mask, that's certainly up to them to do so.
Yeah, I apologize. I guess what I should have said is,
Yes.
is it your understanding that most grocery stores in town are requiring masks, even though they don't have to, they're choosing to?
They are, at this point in time, they are. So as time progresses and we see what happens after today, I think people need time. It took a long time for people to develop the habit of wearing facial coverings or masks. So it probably will take time, even with the guidance that you don't have to if you are vaccinated. It will take some time to kind of ease or glide slope into that comfort level.
Thank you.
All right, thanks.
Thank you, Dr. Wooten. And again, you know, the guidance in place does not require vaccinated individuals to wear a mask when they go in public. If an individual location wants to do something unique to them, then they certainly can do that. But fully vaccinated individuals per county, CDPH, CDC, are not required to wear masks indoors or outdoors, minus those handful of settings we shared, mass transit, hospitals, schools, and so forth. So with that, do we have any additional questions? We have no more questions for today, so that concludes today's briefing. We don't have any additionally regularly scheduled COVID briefings. If something arises that we need to share or walk through, we will schedule one. But we want to encourage everyone to have a great day. It feels like a very good day, and I think we ought to allow ourselves the opportunity to enjoy today. Thank you all.